Everyone, and thank you for joining me today. My name is Daria Bennett. I'm the Administrative Assistant here at Home of Hope, and today I'll be talking about palliative care and hospice care. In-home health care is what I'll be covering today as well. It's today's presentation. It will cover the differences of home health care options available to those in need, and I'll also be covering a variety of topics ranging from how to get started with these services to how you figure out which is better for you for what stage you are and what type of care you will need. So advanced care planning is how I want to start off today. It's not something that many people think of when they think about hospice care and such. So advanced care planning involves your learning about the types of decisions that might need to be made, whether it's considering those decisions ahead of time and then letting others know, or both your family and your healthcare providers about your preferences. These preferences are often put into an advance directive, a legal document that goes into effect only if you are incapacitated and unable to speak for yourself. This could be the result of the disease or severe injury. No matter how old you are, it helps to have others know what type of medical care you want. Advanced care planning is not just about old age. At any age, a medical crisis could leave you too ill to make your own healthcare decisions. Even if you are not sick now, planning for your healthcare future is an important step towards making sure you get the medical care you would want. And if you are unable to speak for yourself, the doctors and family members that you are working with make sure that they have the decisions made properly for you. With advanced care health planning, it can help you think about who you would want to make the decisions for you if you can't make them for yourself. For instance, it could be a power of attorney, who could be a child, a loved one, a spouse. It just kind of helps to make those decisions about who you would want with helping in your care. It'll also discuss your ways you can share your wishes with others. So knowing who you want to make your decisions on your behalf and how you would decide, it might take some of the burden off your family and friends as well. Sometimes decisions must be made about the use of emergency treatments to keep you alive. Doctors can use several artificial or mechanical ways to try and do this. They might use CPR, which is cardiopulmonary resuscitation, ventilator use, artificial nutrition, which is tube feeding, and artificial hydration, which is your IV intravenous fluids, or comfort care. Making your wishes known. There are two main elements in an advance directive, which is your living will and a durable power of attorney for healthcare. There are also other documents that can supplement your advance directive. You can choose which documents to create depending on how you want decisions to be made. So with a living will, it is a written document that helps you tell doctors about how you want to be treated. If you're dying or you're permanently unconscious and cannot make your own decisions without emergency treatment. A durable power of attorney for healthcare is a legal document naming your healthcare proxy or someone to make medical decisions for you at times when you're unable to do so, whether you're in surgery or you can't speak for some other reason, that's why. Your proxy, also known as your representative, surrogate, or agent, should be familiar with your values and your wishes. From there, we're going to move on to palliative care. And palliative care is a specialized medical care that focuses on providing patients relief from pain and other symptoms of a serious illness, no matter the diagnosis or stage of disease. Your team aims to provide and improve the quality of life for both patients and their families. This form of care is offered alongside curative or other treatments you may be receiving. So if you're in a chemo treatment, you can receive palliative care. They work with you and your family and your doctors to provide an extra layer of support that complements your ongoing care. So who can use it and what does it do? So palliative care may be offered to people of any age who have a serious or life-threatening illness. It can help adults and children living with illnesses such as cancer, blood and bone marrow disorders, if they require stem cell transplant, heart disease, cystic fibrosis, dementia, end-stage liver disease, kidney failure, lung disease, Parkinson's, and a stroke. Some symptoms that they may be able to help improve are your pain. If you're in a lot of it, they are able to come in and maybe get you some medications that you may need. Nausea or vomiting, anxiety or nervousness, depression or sadness, constipation, difficulty breathing, anorexia, fatigue, and trouble sleeping. Getting ready for a palliative care consultation. Make sure you bring a list of your symptoms that you're experiencing. Note specifically what makes the symptoms better or worse and whether they affect your ability to go about your daily activities. Bring a list of your medications and supplements as well. Consider bringing a family member or a friend with you to the appointment, and bring any advance directives or living wills that you've completed. What can you expect? Palliative care is an approach to take care of you that may want to access any stage of a serious illness. It helps you manage symptoms and address concerns that matter most to you. You may consider palliative care when you have questions about what to expect with your healthcare plan and how you can fit it to how it matters most to you. What programs and resources are available to support you throughout your illness, whether it be yoga or a massage or swimming or anything like that, just something that can kind of help keep you moving even though you're still sick. Your treatment options and their pros and cons, so whether that be your medications or if they're corresponding with something wrong, and making decisions in line with your personal values and goals. Your first meeting may take place while you're in the hospital or in an outpatient clinic. Research indicates that early use of palliative care services can improve the quality of life for patients with serious illness, decrease your depression and anxiety. It can increase patient and family satisfaction with care, and in some cases, even extend your survival. During your consultation, your care team will talk with you about your symptoms, your current treatments, and how this illness is affecting you and your family. You and your palliative care team make a plan to prevent and ease suffering and improve your daily life. This plan will be carried out in coordination with your primary care team in a way that works well with any of the treatment that you're receiving. After the consultation, they'll go over your symptom management, which is the steps to include and address your symptoms and improve your comfort and well-being. Support and advice. They have services to include support for the many difficult situations and decisions your family have to make. You and your family may talk with palliative care social workers, a chaplain, or other team member about stress, spiritual questions, financial concerns, or how your family will cope if a loved one dies. Care specialists may offer guidance or connect you with a community resource as well. They can offer referrals if they need to refer you to other doctors, anybody in pain or in integrative medicine, things like that. And they can help you with advanced care planning as well. From there, we're going to shift to hospice care. And hospice care is a special kind of care that focuses on the quality of life for people and their caregivers who are experiencing an advanced life-limiting disease. So hospice care provides compassionate care for people in the last phases of incurable diseases so that they may live as fully and comfortably as possible. They treat the person's symptoms rather than the disease, and a team of professionals work together to manage your symptoms so that the person's last days may be spent with dignity and quality surrounded by their loved ones. It is also family-centered. It includes the patient and the family in making decisions. There's never really a right time for hospice up until you know. It's used when the disease, such as advanced cancer, gets to a point when treatment can no longer cure or control it. In general, hospice care should be used about when a person is expected to live about 6 months or less if the illness runs its usual course. People with advanced cancer should have a discussion with their family members and doctors to decide whether hospice care should begin. So hospice care provides an home care and inpatient hospice service. Most hospice care is centered in the home. There may be times when you need to be in a hospital, an extended care facility, or an inpatient hospice center. Your home hospice team can arrange for inpatient care and will stay involved in your care and with your family. You can go back to in-home care when you and your family are ready. It can help with your spiritual care, which is setting up if you would like to say goodbye with a certain religious ceremony or a ritual. It offers respite care for patients being cared for at home. Some hospice services offer respite care to allow the friends and family to be away from the caregiving role for a little bit. And they also offer bereavement care in the period of mourning after a loss. The hospice care team works with those surviving loved ones to help them get through the grieving process, whether it be a trained volunteer, a clergy member, or a professional counselor. They make the phone calls, the visits, and other things like that to help make sure that those loved ones that are grieving are getting put in the right place. Home health care is a wide range of care, healthcare services that can be given into your home for an illness or an injury. So whether you fall or if you just had surgery, they're usually less expensive and they're more convenient and they're just as effective as care as you would get in a hospital or a skilled nursing facility. Some home healthcare services, for example, they would be wound care for pressure sores or a surgical wound, caregiver and patient education, IV or nutrition therapy, which is a feeding tube. They can do your injections for you. They monitor your serious illness and unstable health status. And the goal of your home healthcare is to treat an injury or an illness like an injury. What you can expect. So doctor's orders are needed to start care. Once your doctor refers you to home healthcare services, the home health agency will call and schedule an appointment, and they'll come to your home to talk with you about your needs and some questions about your health. They will also talk to your doctor about your care and keep your doctor updated about your progress. It's important that home healthcare staff see you as often as the doctor ordered. What they'll do in the home is they'll check what you're eating and drinking to make sure that you're not eating anything that you're not supposed to be. If you need extra vitamins, they'll kind of help provide you those foods that just kind of help give you a little boost. They check your water or your blood pressure, your temperature, your heart rate, and your breathing, just so your vitals and everything are kept track of. They check to make sure you're taking your prescriptions and your other drugs and any treatments correctly. They ask if you're in pain. They check your safety in your home, whether there's any fall risks or just anything that may cause any harm to you. Teaching you about your care so you can take care of yourself, and they also coordinate your care. So that means they must communicate regularly with you and your doctor and anyone else who gives you care. As always, Home of Hope is here to help, and I hope you enjoyed my presentation today. Thank you.